Hey y'all, how's it going? It's been a minute since I've uploaded a video, but I felt like I should come and share with you guys what all I've been experiencing as a new grad nurse. First off, let me just say school or nursing school and nursing are almost two totally different things, okay? Let me just say that. Why do I say that? Because your experience as a nursing student will be completely different when you actually begin to work in the field of nursing. I'm sure you're like, some of you are like, common sense, duh. Well, there's a lot of things that I learned differently once I became a nurse. I feel like I don't know anything, y'all. If I'm going to be honest, I really feel like I don't know anything. Like, I know I learned some fundamentals in school. I know I learned some things that are set rules in the field of nursing and will never change, okay? However, with certain things, there's loopholes. There are exceptions to certain things. Sometimes you cannot be completely sterile when trying to insert a catheter. Foley catheter, in and out. I've had some experiences, and that's what made me think of that, where I was just like, wow, my nursing instructor would have killed me in this situation had I contaminated that sterile field. But the truth is, sometimes you have those patients who you just have to do the best that you can to do your job. And so that's what I'm learning now. Being a new grad nurse is hard to accept that because we've been taught things one way. It's been drilled in our heads to do things certain ways. And when you get out in the field and you actually start practicing these things, it's like, well, that's not how I learned it. Or when people insert the NG tube and they don't aspirate the content to test the acidity. I'm just like, I thought that was an integral part in inserting NG tube. It's really not. It's crazy. It's really not. And so they do the x-ray confirming for placement and stuff like that, but it's just the processes that things are done in, that's new to me. What they also don't teach us in nursing school is how to communicate with the doctors. Now, I had a simulation class my last semester. It was something called Senior Capstone. It was geared to prepare us for the NCLEX, but it was also, we had simulations where we would have different situations and we would practice as if we were in a real hospital. One time we had a birth. The other time, let's see, what did we have? We had a cold. It was just different things. And we had to work together to help the patients. So I learned a little bit about communicating with doctors in the simulations, but in my clinical experience, during clinicals and in the classes, I did not learn that. I did not learn that some of these doctors, you know, they do feel like they're superior. They want to school you on what's what, like you haven't already had a formal education. And you face some belittling. You deal with that. Those are some things that I maybe wasn't prepared for. And I'm still learning how to deal with that. I know that practice makes perfect, and it's going to come with time where I'm just going to be a beast at it. But for right now, y'all, I feel like I don't know anything. And I think it's best for me to be honest and just go off the bat and say that. Speaking to my nurse manager, I really love her, by the way. She's awesome. I will say that she's awesome. She was an LPN before she became an RN, and now she's actually has her nurse practitioner license, but she's our nurse manager. And she was just explaining that it takes at least 2 years for you to feel like you're, I guess, competent. You're never really 100% comfortable, which you shouldn't ever feel like you're that comfortable, because that's dangerous. It takes 2 years for you to feel like you're actually competent, like you're a good nurse. You feel like you have gained not only skill, but you have learned the way it works. You've learned how to communicate with the doctors. You've learned how to order special things for your patients, interdisciplinary teams. You know how to work with social workers and a physical therapist, occupational therapist. You know how to communicate across the board in order to provide the best quality care for your patients. And so I'm just on for the ride. I'm just trying to get to that point where I can feel like I'm a competent nurse. Right now, I'm just a safe nurse, okay? I don't do anything without asking questions. But because I feel like I don't know anything, y'all, I doubt myself a lot. Okay, I doubt myself more than I thought I would doubt myself. But it's just different. It's different not being in school and having to learn these things and kind of relearning certain things that I learned a different way. It's kind of crazy. And learning the aspects that I didn't learn in nursing school, that's crazy. But I'm going to get there. Like I said, I'm along for the ride. I'm going to keep on keeping on, okay? I'm yet holding on, and I'm going to keep on keeping on. So I know there's some of you who might have just graduated in May. It's the end of the month, so I'm sure most people have had their graduation ceremonies, ring ceremonies, whatever, by now. You're a new grad nurse, or you're on your way to becoming a new grad nurse, because you have to get the NCLEX behind you. So that next step is just dealing with the nervousness, butterflies, not knowing what to expect, and just feeling crazy, running around like you're crazy. It just comes with the territory. I will say that. I'm not going to sugarcoat it for you. I'm sharing my experience with you. You're probably going to feel the same way. And that's something that it comes with it. So for all of you who are getting into the field, you've passed your last class, you've passed the exit HESC, you're on your way to passing the NCLEX. I just want to say congratulations to you. You have so much to look forward to. Years and years and a lifetime of learning new and interesting things, okay? And one thing I can say, another thing I learned is that my mental health instructor did once say to us that every patient is a psych patient. Boy, is that the truth. I have learned since I stepped onto that floor that every patient is indeed a psych patient. Y'all, it's real, okay? Just be prepared for that. Just be prepared. Don't go in with thin skin. You have to really be ready. Put your game face on. My preceptor told me that she didn't realize that I was feeling overwhelmed and having some anxiety until I said something because she said that my game face was just so strong that it just didn't look that way. So what I'll say to you is, even though you are nervous as hell, even though you feel like you don't know anything, you're doubting yourself, you're second guessing and questioning everything, just have your game face on. It doesn't hurt to have your game face on. You, just like when you're testing in nursing school, you answer the questions based on what you do know, not based on what you think or what it could be, or the overanalyzing. Is the same way in the real world. When you get on that floor, if a patient has a question, if somebody asks you something and you don't know, or you may know only so much about it, you answer based off what you do know. And whatever you don't know, well, let me find out. Okay? Because we're not walking encyclopedias. Okay? We don't know everything there is to know about nursing. Doctors don't even know everything there is to know. Okay? Regardless of how superior they feel towards everybody else, they don't even know everything. So you have to go into it with that type of mindset, just knowing that we're all human. There's always room for error, but the one thing you want to do is be as safe as possible, which is what the NCLEX is about. So it all ties in together. It ties into each other, and I feel like eventually I'll get the gist of it. And I'm going to be a beast eventually. But right now, y'all, I'm just a new grad nurse, okay? And I'm just trying to pay my dues, get the experience under my belt so that I can be a boss at it. Okay, that's my ultimate goal, is just to be great. So I've been dealing with that. Been doing a lot of things in my personal life. I went to the Bahamas in April, like maybe 2 weeks after I started orientation on the floor. I've just been doing a lot of things at home, just personal things. So I have not been recording videos, but I do plan on starting recording videos, just keeping you up to date on how things are going as a new grad nurse and what you can expect as a new grad nurse, just things like that. Okay? So I'm glad you're still subscribed to my channel, because I have not been putting out any content, and I know it's annoying when you're subscribed and you're looking for that next video and you're like, well, what is she doing? But I'm just living, y'all. I'm living one day at a time. I had some time today. I'm off until Friday. So I figured, why not come on here, do a video, and let you guys know what's going on with me. Okay? Congrats to all the graduates again, and good luck. Best wishes. I don't believe in luck, but be blessed on your NCLEX. Now is the time to prepare. Knock it out the ballpark, okay? I honestly feel like the NCLEX was much easier than the exit HESI. That's just my opinion, but I have heard other people say the same thing. So I feel like if you conquered the exit HESI, you will indeed conquer the NCLEX, okay? But no matter what happens, no matter the outcome, you just remember to stay at holding on and keep on keeping on, baby, okay? Ain't nothing changed. I'm still going to be saying keep on keeping on, baby, because I'm still going to keep on keeping on, okay? So that's it, and that's all, y'all. I'm grateful for all my subscribers. I thank y'all for watching my videos, commenting. Thank you. You're amazing. You're a blessing to me. You truly are. And it just feels so good to be able to relate to so many different people on this level. So yes, thank you. If you're not yet subscribed, please hit the subscribe button, like this video, thumbs up, y'all, thumbs up, and y'all be blessed. Bye, y'all.